of.
Okay.
Right.
So when was your earliest symptom?
I think my parents started noticing it at 12 years old. I started like shuffling my feet and kind of dragging my feet along. I didn't actually notice it that early, so.
Got it. And then when did you start meds?
14, I was diagnosed with dopa-responsive dystonia.
Uh-huh.
But then my condition kept progressing. I had to keep upping my medication. So then I started seeing Dr. Kessel, and I was 18 at the Parkinson's Research Center. I almost said Super Center.
Yeah. So it's more than dopa-responsive dystonia,
yeah,
right?
So
that was a misdiagnosis.
It was a misdiagnosis.
Because of your age, and you responded well to L-Dopa, but you don't have...
yeah, overnight, it was an instant change overnight.
Yeah, because you needed the dopa.
It was so nice.
Yeah. But are we clear that is not the diagnosis?
Correct.
Yeah, okay. But that's not. Okay, and then age 18, you started with Silky Pressol.
Yes.
And your current medications are they here?
Yes.
Four of them. Four of them, sorry. So you're taking one milligram. Yeah, sorry.
Math's not my strong point.
Well, apparently not mine either. That's terrible. Okay, so you're taking 4 tablets. With your IRs.
Correct.
Got it. That's your Parkinson's meds, right?
That's all my medication.
Got it. And the only surgery you had was for the big toe?
Yes.
What are the symptoms that are interfering with your life?
There's like a very big scale of them, and it starts as low as just like getting stiff and having a little bit of tremor like throughout my full body. But like the worst case scenario, I can't walk. Like just even when I think today wasn't even at my worst. Like my feet get so shaky, like kind of like this, and I think I get dystonia in my feet because they're like pointed and I can't unbend them. It's like a really full body thing, and I can't, like, in my worst case scenario, my worst day, like, it feels so, like, heavy in my brain, like, I can sit up because I'm quite strong.
Can I interrupt for a second?
Yes.
Is that when your meds are wearing off?
Well, even my medication, I was on it all day this morning, but that's how I feel when my medication's wearing off.
Okay. When you get that feeling, that horrible, I'm stiff and shuffly and dystonic and that, can I call that off?
Yeah.
I feel off.
Did I say?
And no, and I'm sure you did. And then when you take your meds, when you're off, do you feel your meds kick in and then you come back on again?
It takes about 45 minutes.
Or variable, depending on how much
variable.
protein is in your stomach and all that. But you respond to your meds.
Oh yeah, I can. Yes.
When you are at your best on.
I'm like nobody knows I have anything the difference.
Wow. So no balance issues.
I do CrossFit. I don't know if you're familiar with that. So
okay.
Just a strength issue. But yeah.
Yeah. So when you're good, you're really good.
Yes.
And when you're bad, you're stiff and frozen and shuffling and.
But it's like it immobilizes me basically.
Got it. When you are, and this is a hard concept. So there's on and there's off. When you are off, is there an emotional off as well? And this is an important concept for me. Every human being on the planet would be angry, frustrated, upset with the disease as it's off. I can't wait till the darn medications kick in and okay, I'm good again. Or that would be called, then I would have thought, a normal emotional reaction to being off.
Yeah.
Some Parkinson's patients have more than that. Oh. They get a blackness, sadness, overwhelming. The clouds come in. It's like a profound, we call it anhedonia, but it's a deep sadness, suicidal ideation, black, just leave me alone. It's more than just the frustration of being off your meds. Do you get that at all?
I don't feel like I can relate to that.
Okay, no. So I don't want extremes. I want
routine.
The routine. You've had when you have a bad off and the legs are doing that.
Yeah.
What are you feeling emotionally at that time?
Well, like on a totally normal day, because like it happens like 3 to 5 times in a day at least.
Yeah.
I just get bored. feels like I can't do anything.
Okay,
so
fine.
I'm
Fine.
pretty
That's
good
what
at
I'm wondering. You're not
Sometimes-
inevitably getting a change
Like, I
in your
don't-
emotion as well.
Yeah, I don't cry like every time like I used to, but I kind of got over that, and I'm getting more patient with it.
Waiting for it to pass, waiting
and, like,
for the
kind
meds
of
to kick in.
occupying myself as much as I can. So
Got
yeah, on a normal day-to-day, hour-to-hour basis, I handle it okay, I think. But then on the
Okay, I think I'm getting it.
But
Anything else? Any other symptoms? Do you have cognitive symptoms? Or have you taken a hit intellectually because of this disease?
I think I'm just no.
I think there's brain fog.
When I am off,
You're off, I appreciate that.
Yeah, when I'm off, I have trouble focusing.
And you're slower to come up with the answer, although you might get the answer eventually.
And I get like flustered a bit more. I like kind of a little bit. What's the word I'm looking for? I don't know what the word.
Well, sometimes when you're working on something, you say, "Well, I can't focus right now, so I'll do this later."
Yeah.
Now, when you're on and at your best, how's your thinking?
I think it's pretty average.
You felt it's okay.
What is it based on?
Yeah.
Memory is a horror. Yeah, I don't have a good memory.
Okay.
Yeah, I have to write things down all the time.
But there's definitely a memory issue.
Forgot about that one.
Of course you did. So you haven't lost your sense of humor. But you could be left at a mall and know how to get out of the mall.
Yeah.
It's not like, oh, we can't leave her alone.
Little thing. No.
You okay?
For things that were setting conversations and stuff like.
I'll forget if we watched him.
No plans and.
But would you? It has not reached a point where you would be uncomfortable allowing her to write a check.
No.
Allowing her to buy something over the internet.
No.
Has there been any inappropriate behavior in response to the medications? Organizing things, obsessive compulsive.
That's just me, though.
Well, I don't know. The only thing I would say is
you can say it.
I mean, I think she. I don't know if this is it or not, but she'll like organize the house in one way.
Yeah.
Everything is fine, and then she'll immediately a week later she'll organize it another way.
Okay.
In my head, I just feel like there's a better way it can
That's
be
the
done.
only thing.
So I feel like it's a practical sense, but I don't know.
Do you think that is interfering with her life? Or no, that's just what she's doing.
It's
interfering.
It's interfering with the cleanliness of our home right now.
Yeah. Okay. So you're not gambling. You're not on the internet compulsively buying. You're not out of control.
No.
You're in control.
Yes. I think the way that the organizing does interfere with my life is like I want to get it done before I go to bed, but I know there's no way I can get it done before I go to bed, so that's why I stay up so late. I don't know if that's interfering.
Yeah, so do you stay up and do it?
Yes.
And hurt your sleeping?
Yes.
You can't let it go.
Almost every night.
Yeah, so that's a little obsessive compulsive because it's probably in your best interest to sleep.
Totally.
And then maybe attack it the next day, but you can't let it go. Okay, do you
But
have problems sleeping?
No.
Does she fight her dreams?
I scream myself awake sometimes.
She gets night terrors, yeah.
I like scream myself awake sometimes.
Yeah.
Is she fighting her dreams? Is there a movement like she's struggling and fighting, or she just screams out?
There's not movement. I think it's more screaming.
Yeah.
Yeah. And the thing with screaming myself awake, I feel like I can feel my symptoms coming on, so it turns whatever I'm dreaming into a nightmare.
Oh, because it's as if someone.
So it's I'm I can't run, and then I can feel myself.
So do you have trouble getting through the night then because of your symptoms?
If my pills run off, then I'll wake up.
Tight.
Yeah.
Is there a pain associated with the tightness? Is it so tight it's like a sports Charlie horse?
It's just uncomfortable.
Okay.
The only
you
time.
describe it as pain sometimes. Though.
It's painful when it's on for so long it starts turning into a cramp in my calves mostly, but sometimes it gets I'm uncomfortable all the time when I'm off, and sometimes it's I can't bear it. It's just depending on how long I've had it.
What about when you said that your toes feels like it's gonna?
Oh yeah, my toes. When the dystonia is so bad, they feel
off,
like they're gonna
talking off.
Yeah, when they feel like they point outwards and they feel like they're gonna kind of fall off.
Outwards.
Outwards.
They don't twist in.
No, so my toes go outwards and upwards.
Your toes go up and out, but your foot goes in.
Yes.
With your foot turn in like that.
It's
yeah. And then the toe goes
that.
up and yeah. That's a dystonic posture. Is there any family history of any medical problems?
Am I missing anything else?
Yeah. Okay. Anything else?
I don't believe so.
And then social history. You're married.
Yes.
When did you get married?
2014.
Any kids?
No.
You don't. Do you have this symptom? I am really good. No one knows I have Parkinson's. Holy cow! I just froze. I can't move. I can't move. I can't move. I came back on again. 5 minutes later, I'm okay again. Ooh, hope no one saw that.
No,
I don't have on freezing.
I can probably feel it like 40 minutes or 45 minutes before anyone else can see it.
You have end of dose.
Yeah.
Wearing.
Just outside of White Rock.
Oh, you got no tone there, yeah. Okay. Just I'm going to ask you to do a few more things. Just put your hands on your knees and just tap for me.
This would have been totally different half an hour ago.
Yeah, and then that side. This is you at your best.
This is me at my best.
Okay, stop. With your feet up an inch.
My right side's better.
And then the left. Yeah, you're perfect, right? So here, put your arms like this and get out of the chair and put your arms down. And I'm going to watch you walk, okay? I'm going to open.
I also